Right now, Utah ICUs are pushing capacity, but doctors are still working with COVID-19 patients who are recovering at home. Intermountain Healthcare has developed a brand new program to make that possible.
I had a little tickle in my throat and a tiny little cough.
That's the way 71-year-old Valerie Jackson describes early symptoms of her COVID-19 diagnosis.
It just got worse really quickly.
Valerie becoming so sick, she went to the emergency room. Doctors examining her, determining she's not sick enough to be admitted, but still needed oversight of her condition.
So we realized early on in the pandemic that we needed to figure out a way to assess oxygen levels for people who are in the community.
Dr. Joseph Bledsoe, Director of Emergency Medicine Research with Intermountain Healthcare, says that need is the reason behind their patient monitoring program, which launched this past August.
I think the program is working spectacularly.
The program allows patients to rest at home while still having the eyes of healthcare workers on them to track and act upon clinical deterioration with a simple, easy take-home tool.
And it consists of basically just one of these. It's a pulse oximeter that records your oxygen levels and your heart rate. It syncs via Bluetooth to your phone or tablet and then sends that signal back to a remote patient monitoring center.
Those centers are staffed 24 hours a day, 7 days a week, not only receiving data, but also checking up on patients on a consistent basis.
Because when I was too sick and too tired, I was sleeping all day. I didn't even think about the monitoring system, and so I didn't even call them. And then they'd call me, and very nicely they would say, Mrs. Jackson, we need your readings. Could you please check in with us?
With regular real-time data coming in, patients are always being evaluated, and their treatment plan can be accommodated quickly.
We've been able to bring many patients back to the emergency department, and likely earlier than they would have otherwise, so they could get evaluated and either treated or admitted to the hospital.
In Valerie's case, her monitoring led to doctors bringing her back to the hospital based on the numbers they were seeing, acting quickly in a serious situation and giving her hope and confidence to beat COVID.
It was good because it gave me some confidence. You know, I didn't feel so alone.
It just provides comfort to patients and also to their family members.